So there are several types of treatment for nail infections. At the lower end of the treatments are the home remedies. So Vicks Vapor Rub, Listerine mouthwash, tea tree oil, which you would apply to the affected area probably every day. Moving on from those treatments are the topical treatments that are either prescribed or bought over the counter. So things like Loseril, Lamisil, topical Excelor, which all have their place in that they tend to keep the infection from getting worse, but very rarely do they actually cure the infection itself. Nails are porous, but they're not porous enough for enough of the liquid to get through to actually kill off the fungal spores that are there. Moving on from topicals, we have systemic medications such as terbinafine tablets, and you would take a course of these tablets orally. Unfortunately, they also have side effects, so by taking them, you're potentially exposing yourself to side effects which can make you feel quite ill, and in some rare cases can be quite dangerous, such as liver function problems. Moving on to surgery, which would be the next stage, you can have the nail removed and either let the nail grow back, but in the majority of cases it grows back with the infection still because the fungus is on the nail bed, on the skin under the nail, rather than the nail plate itself, so you're no better off. Or you can have the nail removed and a phenol chemical put down to stop the nail from growing back, and it's a case of the lesser of two evils, having no nail at all or having a fungi infected nail. These procedures, whilst not particularly big of procedures, they're quite traumatic in terms of it takes a couple of weeks to recover. You won't be able to drive straight after the procedure because you've had a local anaesthetic, which invalidates insurance, and you're then open to other infection because you have an open wound. Moving on from surgery to laser therapy, there are a couple of types of lasers. So there's hot lasers, which kill the fungus purely by heat, so they heat it up to a certain temperature where fungus can't survive. Obviously, the fungus is attached to you, which means that it's quite an uncomfortable, if not painful, treatment because you have a lot of heat going into a very small area. These treatments are as effective really as pain tolerance. So some people have a much higher pain threshold and can have quite an aggressive treatment which will kill off the fungus, whilst other people can't really stand the discomfort of the treatment and won't really get any good benefits. Also with hot lasers, they purely kill fungus. They don't regenerate any tissues, they don't change the shape of nails or nail beds or anything like that. So it's just really a one-trick pony. From hot lasers, we then have cold lasers, and cold lasers work in a totally different way. So they work by photochemistry. They use your body to kill off the fungus, and they use your body to regenerate the tissues in the area. So they can be used on damaged nails as well as fungal infected nails. And these lasers are absolutely painless. What they do is they increase the blood supply to the area, and that kicks your immune system in, and over time the nail should grow out without fungus and far more healthy.